listening to WNHHLP 103.5 FM, New Haven's home for community radio. I'm Mubaraka Ibrahim, and this is Mornings with Mubaraka, streaming live from the Beaver Hills section of New Haven, Connecticut. We're also live on TuneIn Radio, Facebook. I'm on my Instagram account. We are on Periscope. We are on Stream Me Radio. So you can tune in and continue to listen no matter what your listening preference is. And I want to remind you right from the jump that if you miss any part of this show or previous shows that we did, then you can find them archived on SoundCloud or iTunes. Just look for our radio station, WNHH and New Haven Independent, for all of your hyper local radio. Today is Wednesday, of course, because this is your Wednesday morning voice, and it is April 22nd. And you're probably well aware, as I am, here in Connecticut, we are about in week 5 of the worldwide pandemic. And it is unfortunately a common thing now for us to say, and everybody knows what we're talking about. And it's interesting because often, particularly with social media, we are wondering if other people can relate to what we're doing or what we're going through. And this time, the whole world relates. We all relate to one another because everybody is kind of in the same situation, but not exactly the same. So today we are actually talking about what I'm talking about is I am talking specifically about the deaths of African Americans in the whole scheme of what's going on, right? So we know here in America that African Americans in particular are dying at unprecedented rates from the coronavirus. And so what I'd like to talk about today is give you kind of my take as to why that's happening, what we need to do immediately, and what we need to do long term in order for us to hopefully change that dynamic of what's going on in the African American community. So why is this a problem, and why have we just started talking about it recently? There's a couple of reasons. One, when the pandemic started, it actually started in China, as we know. Well, 91% of people that live in China are Chinese. There's not a lot of ethnic diversity there. So it wasn't on people's radar that, hey, this might affect one population more than it affects other populations. When the virus began to pick up speed here in the United States, right, we technically have our first diagnosed death from coronavirus in February, but now there is estimations that it may have been in the United States as early as October, based on some anecdotal reports of how people were very ill in October and November of 2019. But when it got to the United States, it revealed both our diversity as well as the health inequities that already exist in America. So the interesting thing to me is that we are acting surprised that coronavirus is killing more Black people than it's killing any other race. As if Black people were not dying at an unprecedented rate from every single disease that we have. One of the biggest health inequities in the United States is the fact that Black people die at a higher rate from every disease. That includes high blood pressure, heart disease. It includes cancer. Black women in particular, for example, breast cancer. Even when we don't get a disease more often, when the disease is diagnosed, we are actually more likely to have severe symptoms, have a later diagnosis, and more likely to die from it. So breast cancer is an example of that. Uterine cancer is another example of that. Even things that should not necessarily lead to a high rate of death, natural occurrences like being pregnant, like giving birth. Black women are more likely to die from these things. Now, what I want to talk about in this show is what exists, why does it exist, and what are some of the things that we can do to combat it, both short term and long term. So first, I think that we have to be very aware and really just submit to the fact that Black people have more existing illnesses. So when coronavirus attacks the system and people get the virus, the more existing illnesses that they have, the more likely they are to die from the virus. So if you have an entire population of Black people, and again, Black people are dying more often from corona than Hispanic, non-Black Hispanics, right? Non-Black whites, obviously, that's an oxymoron, but than white people, than Asian people, than Native American people. Black people are dying, even if you are of the mindset that, hey, the numbers have been overblown. Not this how many people have died. Even if you decrease the amount of numbers of people who have actually died from the coronavirus, you're still going to find that more Black people have died from it than any other race. So, why is that? One reason is that we have more existing diseases. So one of the statistics so far that we know from the coronavirus is that if you have 3 or more existing health issues, then you are more likely to actually die from the disease. So if someone has diabetes, has heart disease, which very often leads to heart disease, and they're obese. Obesity is a disease. Obesity is a risk factor. We're finding that it is actually about number 3 on the list of risk factors from dying from coronavirus. And since more than half of the United States is overweight, more than half of us are at risk for coronavirus to actually be severe or lead to actual death. So if you have 3 or more existing diseases, then you're more likely to die from the virus. So we know that Black people have that. But one of the other things that have been pointed out, particularly by Governor Cuomo in New York, is Black people are more likely to have essential jobs, right? So right now, we're asking everyone to stay home except for people who are essential workers. Essential workers includes people who work in the grocery store, right? People who are actually cleaning and janitorial services, right? Of course, the doctors and the nurses and the medical professions. So if a lot of these essential workers, right, people who work in the grocery stores, who until recently wasn't even required to have the business owners required to give them PPE, right? We have always pushed for PPE in the hospitals and the doctors and the nurses, and everybody needs to be protected. But there was no major push for PPE for essential workers for several weeks. So if Black people are the people that is getting up and going to work every day, then they're going to have a higher risk factor, right? So when we talk about some of the states who are now pushing to reopen, and they're opening as soon as Friday, right? Tennessee, Georgia, these states, the people that are going back to work, that they're pushing to go back to work, are people who are Black, who are more likely to work in hair salons, work in barber shops, right? Work in these low-wage jobs. And the interesting thing to me is that this push to have people go back so soon is not push for essential things that we need, right? How many of us are sitting in the house saying, oh my God, I can't believe I can't go bowling today? right? So bowling alleys, okay. So these are not essential jobs. These are not things that absolutely need to be opened up right away, right? So Black people are more likely to actually have these jobs and still being exposed on a daily basis. But the biggest risk factor is the fact that we are more likely to have existing diseases. So I want to give you some, when I say more likely, I want to give you some statistics that even shocked me since I hadn't looked them up in quite a while. Black women 20 and over. So we're not talking about senior citizens. We're not talking about people who are 70 and 80 years old. 20 and over. 49% of Black people 20 and over have some form of heart disease. If heart disease is a major risk factor from dying from coronavirus, are we not? Why are we surprised that Black people are dying? Black men have a very high percentage that have high blood pressure. Black people in general, there are several reasons why there is several theories why Black people have higher instances of high blood pressure. And one of them is there is a genetic factor. No, not every single Black person has these genes for having high blood pressure, but there is a genetic factor for some Black people. So the one thing that I also would like to really point out as we're discussing this is that when we talk about Black people in general, of course, we're not a monolith. Of course, there are genetic differences even within the Black community. And I also like to point out that when I talk about Black people, I'm specifically talking about African Americans. I am talking about African Americans who are descendants of enslaved people. This is a really important distinction to me because even in public health, when we talk about the difference in health outcome, there is a difference in health outcome for African Americans who are descendants from enslaved people who have been in America for generations and generations, and African immigrants or Afro-Latino immigrants. There is a difference in health outcome of those two groups of people, and we have to be really aware of that so that we are not grouping everyone together. There is a uniqueness both in a positive way and in some not so positive ways for the health of African Americans descended from enslaved people. So when we talk about the existing health issues for African Americans in particular, we're talking about 49% of Black women 20 and over having some form of heart disease. We're talking about 50,000 women a year, right? 50,000 women annually, African American women, they actually have heart-related incidences. So that is a significant portion, right? When we talk about high blood pressure, 40% of African Americans have high blood pressure. All of these are major risk factors for coronavirus. So I guess the next thing, now that we know this, right? Heart disease, high blood pressure, diabetes, one of the highest risk factor that they found, particularly in Louisiana, is having kidney failure and kidney disease, right? That was actually the highest risk factor from dying from coronavirus. Now, how does this affect African Americans? When it comes to diabetes in particular, African Americans are more likely to have unmanaged diabetes. They are more likely to have some residual illnesses that are connected to diabetes. They're more likely to have kidney failure, right? Because of the diabetes, right? When you look at everybody who has diabetes, African Americans will have more of the accompanying illnesses that go along with it, right? For me and my personal experience, growing up with a mother that got gestational diabetes when she was pregnant with my little sister, and then it never went away. It turned into type 2 diabetes that quickly went from her taking pills to her giving herself shots. And she was not uncommon. She was just one of 49, million people, African Americans in America that have type 2 diabetes. But she was also part of part of the group that were twice as likely for gestational diabetes to turn into type 2 diabetes. For African American women, they are twice as likely as any other race for their gestational diabetes to turn into type 2 diabetes, because gestational diabetes happens when you are pregnant. For many women, once the pregnancy is over, the diabetes goes away, right? But for African American women, they are 2 times more likely, twice as likely for it to turn into type 2 diabetes. Well, for her illness killed her very slowly. For many African Americans today in this pandemic, that illness is now creating an express ticket to the morgue. So it's really important that we recognize this and we say, okay, what is it that we can do right now? So the first thing says, I'm really of the mindset that now that we know the problem, let's talk about the solutions. Let's talk about the immediate solutions. So one of the dilemmas that I see, and again, I am looking forward to this all being over. And I'm also looking forward to seeing the studies that come out of this, the observations that come out of this. Now, another reason that possible reasons for African Americans dying more often from coronavirus is the fact that, one, we have these existing illnesses. So we are going to get the virus, it be more severe for us. The second part is African Americans are less likely to actually trust the medical system, and justifiably so. We had everything from the Tuskegee experiment to the exploitation of Henrietta Lacks to the current injustices and biases in the medical system. So Black people are less likely to trust the medical system. And we laugh about this, right? Oh, let's take some ginger ale and take a nap and it's all going to be better. But the truth is many Black people are doing this, right? We started off this pandemic with, Black people can't get coronavirus, right? We know that that's not true. It just took a minute to get into Africa. Then we went into they're just, they're making up the numbers. They're not telling the truth. They're just trying to scare us. A very common and perception from African Americans because of our mistrust based on our historical injustices from the American health system, we are less likely to go. So when you do go to the hospital, now you're inside of the system. And when you're in the system, okay, I can't avoid going to the doctor. I definitely need some help. When you get there, it's more severe. We know that this is a pattern that goes across many different diseases. As we mentioned earlier, this is one of the reasons why Black women are more likely to die from breast cancer, right? We wait and wait and wait, and then we're not going to the doctor until it is a severe illness. It's more severe. It's not preventive care. It's not we caught it early. It is, hey, this is type 3. Hey, you're in stage 4, because we wait too long to go to the doctor. And again, we know that Black people are not a monolith. This is not for every single person. I'm sure there's going to be somebody that says, well, I go to my annual appointment every year. I do too. But when we're talking in general, what is the more common thing that exists in our community, and we have to be very honest about the things that exist in our community, both the good and the not so good, because we cannot just sit around and talk about just the positive things about our community and not recognize our faults and the things that are going to actually lead us to have a worse health outcome, right? So once we go to the doctor, it's going to be more severe. So if you have this pattern of never going even to your annual appointment, you only go to the doctor when you have to go to the emergency room, then you're going to sit home and you're going to try to self-care as long as possible. And then when you get to the doctor, now we are in a health system that already has pre-existing biases for African Americans. We know this from lots of different studies, right? So this is not new. And if you're interested in finding out more, you can Google implicit bias in healthcare. We have all of the studies. When Black people go to the doctor, they are less likely to be taken, their symptoms to be taken as serious, as severe as other races. Even when it comes to pain, they've done studies and they've given doctors two identical patients, identical health history, identical symptoms, and they find that the doctor is more likely to prescribe a pain medication, a prescribed pain medication, to a white patient than they are to a Black patient, right? This is an implicit bias that goes with the racist culture of America, that Black people are stronger, that Black people can tolerate more pain, that Black people are more resilient, that Black people lie. All of these are existing cultural biases that does not change when somebody becomes a doctor or a nurse. The cultural bias is still going to be there. So when we talk about getting into the healthcare system and then actually getting help, now this is an entirely different issue. So the biases don't just stop from, hey, all of these things happen and it's because of a historical racism that we have diabetes and high blood pressure. Okay, now that we have it, let's go get help. We're less likely to get help. When you go to the doctor, so this has actually been a catch-22 for us. So we know that there is a severe opioid crisis in the United States. The addiction to opioids, death by overdosing, and this crisis has ravaged the white community. And again, statistics, you can Google it. One of the things that public health professionals say is that this implicit bias that has actually played against us in diagnosis of disease, in being treated for disease properly, has actually played for us when it came to the opioid crisis. We know that part of the opioid crisis, it was doctors overprescribing medication for pain, overprescribing medication for too long. Now, opioid is a pain medication. Black people are less likely to be prescribed a pain medication. So you can come in with the exact same illnesses, the exact same symptoms, and the doctor's more likely to tell you go home and take some Advil as opposed to here's an opioid prescription. And so as a result, Black people were sort of protected from the opioid crisis from the level in which it affected white people, because white people were more likely to be prescribed opioids. But when it comes to something like the coronavirus, that's not going to play for us. That's going to play against us. When the implicit biases in the healthcare system look at Black people as being more resilient, as having less pain, as symptoms being less severe, how many Black people are going to be sent back home as opposed to actually being admitted into the hospital? How many Black people whose symptoms were ignored are going to be go home, isolate yourself, and see if you can do some self-care? Then by the time they return to the hospital, right, in an ambulance, in an emergency, now they're in the ICU. Now they're more likely for the risk of dying because the symptoms were not treated at an earlier stage. All of this is playing into the numbers that we are seeing for Black people. If you're just joining me, then you're listening to WNHHLP 103.5 FM, New Haven's home for community radio. I'm Mubaraka Ibrahim, and this is Mornings with Mubaraka, where we talk about national issues from a local level through a lens of diversity. Today's show is COVID while Black. Why are Black people dying at unprecedented rates from the COVID-19 virus, and what is it that we need to do? So as we talked about all of the things that leads up to Black people dying that can contribute to all of these numbers. We know that here in New Haven, of the deaths that we've had, 41% of them have been Black, 23% of them Hispanic, 21% white, and 35% unknown. Now, being that over a third of the numbers are unknown, I kind of take these numbers with a grain of salt, but I have no doubt that more African Americans in New Haven, Connecticut is dying. When the demographics of our city is actually pretty evenly split, we have about 34% African Americans, I believe about 31% Hispanic, and then about 30% white. So we're a pretty evenly split city. So for more African Americans to beat the national numbers from all of the causes that we mentioned, having more existing health conditions, not going to the doctor before the symptoms are severe, getting to the doctor and your symptoms not being looked at as seriously as other races, and that actually leading to death. So what can we do? Now, I know that there needs to be a multiple prong approach, both short term and long term, to this issue. So in short term and long term, we need to take some personal responsibility. And this has always caused a firestorm of tweets and Facebook posts and people saying that you're victim blaming. Personal responsibility and recognition of historical racism are not opposites, and they're not synonyms. We can recognize both the implicit bias in the healthcare system as well as the fact that African Americans are less likely to exercise, right? So one does not cancel out the other. So I'm always confused when you talk to people about what you need to do personally as far as improving your nutrition, actually doing physical exercise, really focusing on your mental health and managing stress, and then that's somehow interpreted as victim blaming. I don't understand how we can take personal action and personal responsibility for every other aspect of African American life and disadvantages, such as our financial situation, right? So we talk about the historical inequities in finances and economics and redlining and Black people not being able to get loans, but yet and still we encourage Black people to open their own businesses because it's something that they can take personal responsibility and personal action towards. We encourage Black people to break generational curses and buy a house, which is a personal action and a personal responsibility towards changing your economic condition. We implore Black people to be more conscious and money savvy and understand what credit scores mean. All of these things are taking personal accountability without denying the fact that redlining exists and continue exists today and affects the fact that Black people are less likely to own homes. But yet when it comes to health and we tell people to take personal accountability of making sure you're eating more vegetables, that you're not eating junk food, that you're not eating fast food, it all of a sudden becomes victim blaming. How do we switch to victim blaming when it comes to your health, but it's not victim blaming when it comes to helping you break the financial disadvantages that you have? How is that? One can exist along with the other. We need to do what we need to do on a personal level. And this is what Black people have done historically. Before Congress was debating slavery, Harriet Tubman was freeing slaves. Personal action, personal accountability of what can I do to rectify this. She didn't wait for the government to say, okay, you free. Black Panthers saw that kids needed to eat, and they started giving kids lunches and feeding kids. Before food deserts were talked about, before it was created as a part of the actual education system for kids to get lunch, Black people took action before the government decided that they were worth the extra effort. So why are we acting like our health is completely different than this? We have to take personal action and accountability for the things that we are eating. We can't make excuses for ourselves that, oh, well, I don't have any place in my neighborhood where I can get fresh fruits and vegetables. When you go to the store once a month, buy some frozen. The nutritional content is the same. Find ways for you to cook. Actually cook at home. I used to teach cooking classes for people who had unmanaged diabetes. And I was really, really fascinated about how many people literally did not know how to do things like make rice, right? Actual from scratch, or make bread from scratch. Those are things that is going to help you have less processed food, have more control over the nutrition. So we know, for example, with high blood pressure, people who have the gene for high blood pressure, a small 5 grams of sodium can increase their blood pressure significantly higher than people who do not have that gene. So they need to have less sodium. So if I have a propensity for high blood pressure, which I don't know if I have the gene, but I know that it runs very strongly in my family. My father died at 55 from a stroke induced by high blood pressure. Didn't know he had high blood pressure. All of his sisters have high blood pressure. I've had an aunt that died of a brain aneurysm. My grandmother died of a brain aneurysm. It is a really strong gene on that side of the family. So when I'm going to pick up some bread, choose some sauces, I may need to look at the sodium count, because the person next to me who don't have that gene can very easily go to the store and say, okay, I'm going to get this, this, and this just because I like it. But I can't get those things because I like it, because they're going to affect my health differently. African Americans are less likely to exercise. That is significant. That is something that we can do both on an individual level and on a policy level. When we talk about what are the things that we can do to help improve the lives of Black communities, making sure that there's green space, making sure that the green spaces are safe, making sure that they're clean, right? There's an organization here in New Haven, they're called CARE, and they did like a 5-year study, and they were focusing on women and postpartum depression and all of these other things. And at the end of the study, when they asked women in Black communities what was the one thing that they would like to see that can improve their health, it was someplace to exercise. Listen to the people in the communities that need the help. We need more green spaces. We need them to be accessible. We need them to be safe. It is really hard to tell people get up and go for a walk when they go around the block and they gotta skip over a broken bottle. They have to find a needle. They have to make sure that they hold their kid's hand super tight because the kid is gonna run in the street. We have this campaign of making our city bikeable. Make the city walkable. That is what's going to improve everybody's health. Make the city safe enough for people to take their kids for a walk without the anxiety of them getting hit by a car, stepping on a drug needle, getting cut by a bottle that's been left on the sidewalk. That's the policy changes that we need. When you want to improve a community, you have to make the community safe. That's the policy changes that we need. That is going to improve people's health, because one of the biggest effects that people have that makes their diabetes worse, that makes their high blood pressure worse, that leads to heart disease is stress. And it's not just racism stress. It's the stress of everyday life. It's the stress of not knowing if your kid's going to come home alive. It's the stress of you driving down the street and the police is following you. It's the stress of you not knowing whether or not you are going to be able to pay your rent because you're living off of a low-wage job that before you became an essential worker, our state didn't even think that you was worth $15 an hour. Those are the policy changes that we need that can affect people's lives. Give them an economic boost that will improve their health. Again, our research shows all of this is completely accessible. Is your bank account number is more indicative of your health outcome than the number on your zip code. It's not always just where you live, it's why you live there. I live in this depressed area because this is what I can afford. This is indicative of the lifestyle that my job allows me to afford. So we have to approach this from both personal accountability and then hold our elected officials accountable for making effort to improve the lifestyle of Black people. And Black people have to step up and hold our elected officials accountable. One of the interesting things that I always see is that we make jokes about how a middle-aged white woman will call the manager super quick when she's in a store. She's the one that's down at City Hall complaining about this and that. Why do you think they get the stuff that they get? Black people need to be involved in making sure that their voice is heard, making sure we're holding our political leaders accountable. I don't care what race they are. Just because they're Black doesn't mean that they know everything that we need. We have a large contingency of Black and Hispanics on the New Haven Board of Alders, but yet Newhallville has the highest amount of unemployment in the city. But yet we have unsafe areas for Black people. Being Black doesn't mean that they can read our minds. Being Black does not give them the less accountability. It should give them more accountability. You should feel more comfortable with going to them and telling them, these are the problems that we have. This is what we need you to do for us. And not just patting them on the back and giving them an ego boost. Oh, we know you work so hard for us. Oh, we love that you're doing it, just because we're satisfied to seeing a Black face in that position. That Black face should represent us, not just sit there. Not just be the person that is going to say, hey, we did that. I'm be honest, we did that with Obama. He got a lot of pass because him representing us in the position of being the president was good enough for most of us. It was him breaking the ceiling. It was him setting the pace. Okay, so now what do we do? Now what do you do after the ceiling has been broken? We can't sit back anymore and allow ourselves to just watch our parents die before they get to meet our children. We can't just sit back and blame racism and blame systematic injustices. We have to take justice in our own hands. It's really important to me that we as Black people understand that we are not waiting for somebody to save us. We have to save ourselves, and we have the ability to save ourselves. We have the ability. That's what the Black Panthers taught us, right? We are so quick to put up a fist and be all, yeah, we're ready to fight, but you're not fighting for your life. That's what doing things like, even when they would not give us business loans or allow us to shop in their stores, Black people built Black Wall Street. We don't sit around and wait for somebody to give us something. And it's okay if we have to struggle a little bit harder. We're used to struggling a little bit harder, but this is our lives that we're talking about. It's okay for us to say, well, you know what? We know when we go into corporate America, we got to work twice as hard to get half as much. We got to be twice as educated to get at least one up on a position. So you might have to work twice as hard to save your life. You might have to work twice as hard to actually make better choices for your food. You may not have a farmer's market around the corner, but you got a store 3 miles away. You have to think about that. What is the extra that you have to go to and you have to go through in order for you to improve your health and the health of your family? We have to break the generational curse of bad health. I personally am very impressed and proud of seeing all of the Black people who are creating amazing projects to help Black people to create wealth. But what good is creating wealth and owning houses when you don't even live to see them gain value? When we're still dying at 60 and 70, when we're still dying before everybody else. So not only do white people get more wealth, but they're also enjoying it longer. We have to take personal accountability for our health. And it doesn't have to be extreme. It doesn't mean that everybody gotta, go vegan or go keto, or it means making small steps that's going to lead to a better lifestyle. Eating more vegetables, right? Moving more. Instead of a movie night, have a day for your family to go hiking once a week. Have time where you're actually talking about stress and you're actually checking in on one another's mental health. All of those things, making them a part of your lifestyle, is going to improve health. In the immediate right now, what we need to do is, one, if you have an existing illness, now is not the time for you to skip your medication, to not eat what you're supposed to eat. Now is the time for you to be extra diligent with eating the way that you know that you should, because most people know how they should eat. They just don't do it. Making sure that you're taking your medication on time, properly, checking in with your doctor. Most are doing telehealth appointments. Making sure that you are starting to improve your health. No, you can't lose 50 pounds overnight. But yes, the efforts that you have to make to start that journey will immediately help you with your health and help boost your immune system. Going for a daily walk. You don't have to do 500 burpees or run or making an entire hour workout where you're sweating profusely. Simply walking for 30 minutes a day will go a long way in improving your health. It is the prescription for decreasing blood pressure. It is the prescription for helping you manage your diabetes. Those are the things that we can do right now, making sure that you're not inundating yourself with the deaths of COVID, the social media conspiracy theories. Limit your time on social media so that it isn't affecting your mental health. The more stress you have, the lower your immune system is. So you can take your medication, you can eat some vegetables, you can do all of that. But if every time you look at your computer, you're feeling massive anxiety and you're afraid, your immune system is going to decrease and you're going to make yourself more vulnerable for illnesses. All of those things are things that we can do right now. And as we think about coming out of this pandemic, we need to think about how we're holding our elected officials accountable so that we don't just flatten the curve for corona, we flatten the curve on Black health outcomes. Thank you for joining me. My name is Mubaraka Ibrahim, and I hope I gave you some food for thought. I want to remind you to go about your week to be a voice and not an echo. Until next week.